What are some common dosages for the testosterone cream, the compounded scrotal cream?
So with the creams, again, it still comes down to the way it's being done and the way it should be done. The way it should be done is with a transdermal, it should be twice a day. At the very least, some guys may need 3 times a day if they're hyperexcretors. For the most part, I would say AM, PM application should be sufficient. You want to ensure that you're getting symptom resolution, and this will kick in a little bit faster because of the rate of absorption compared to injectables, because it is non-esterized. So it is broken down quicker. I would say that if you're going to go AM and PM, considering the fact that every click is a quarter of an ml or a quarter of a gram, because you usually get a 30-gram tube, 4 clicks will give you an ml. So it really depends on the strength. If you got a 10% cream, that means 100 milligrams per gram, or 20% of 200 milligrams per gram. Understand that it's not a direct science of saying, well, I have double the grams, because you're also cutting the surface area down in half. So when you're spreading a 20% cream across your skin, your absorption rate is not going to be quite as efficient as 100 milligram cream spread across the same area. So if you were to do 100 milligrams on a 10% cream, and that would require 4 clicks, that's not to say that 2 clicks on a 200 is equal, because you're only using half the surface area. So for those that understand what I'm talking about, they'll get it. For those that are a little confused, it's really just more about ratios. But at the end of the day, depending on which cream you're using, and I think most guys tend to use the 20%, the most common that we've seen for symptom resolution is a twice-a-day application, 2 clicks in the morning, 2 clicks at night. And that tends to be the average. And from there, you can adjust up or down as needed. Some guys are going to achieve, super physiological levels at that range, and maybe even some potential side effects. Some people are going to not get enough, and it really depends. I think you're on a higher dose than that, Steve. I believe you're on 150 twice a day, if I recall.
Yes, exactly. Yeah.
So 300 a day via transdermal. I think most guys do well on 200. You happen to be more, I guess, of an alpha personality, a little bit more muscular than your average patient, and you feel good at that level. And some guys only need half of that. So for the most part, I would say 200 per day in a cream is pretty common and pretty successful at achieving what most guys are looking for.
Okay, thanks.